Muy buenos días tengan todos ustedes. Good morning, everyone. Welcome, everyone, to the Border Binational Health Month Proclamation Ceremony. My name is Oda Garcia. I work for the Texas Department of State Health Services, Office of Board of Public Health, Region 11, here in Laredo. Good morning. It is my honor to welcome you to the Border Binational Health Month Proclamation Ceremony. Today, we are joined by distinguished representatives that play an important role in binational public health work. Public health knows no borders. The challenges we face from non-chronic diseases, infections outbreaks, and the promotion of healthier communities impacts families in both sides of the border. This is why binational collaboration is not only valuable but essential. By working together, we can share resources, share our knowledge and strategies to protect the health and well-being of los dos Laredos. This ceremony is a reminder that when two cities unite, we strengthen the ability to respond to any public health challenge, improve access to care, and create a healthier community. Before we begin our program, I want to welcome and thank all of the programs from the City of Laredo Health Department that continuously help us to maintain a healthier Laredo. All the collaborative agencies that are here today. I want to welcome Dr. Victor Di Trevino, our City of Laredo Mayor. Thank you. Ms. Melissa Peña, representative of District 28, Honorable Henry Cuellar. Al Cónsul General de México, Embajador Juan Carlos Mendoza. The Area Health Education Center. We have Casa Misericordia. I want to thank SCAN, Border Region Behavioral Health, and UT Health for being here today. It is my honor to welcome Dr. Victor Di Trevino, City of Laredo Mayor, to give us a few words.
Thank you and good morning, Dr. Victor Trevino, Mayor for the City of Laredo. I'm happy to be here today, joined by everybody else. We're here to celebrate Binational Health Month. And what better location than a place where I was fortunate enough to work 36 years with one of the best human beings that understand the importance of health. Even though this is a month-long celebration of educating and connecting communities with essential health information and resources with initiatives that aim to improve health and well-being of communities on both sides of the border. Most of us in this room already know and understand this fully well, that this is a part of what we do every day, 365 days a year, and every week. A congressman and I fully understand that you can't get to the finish line without collaboration. As a doctor who has practiced on both sides of the border, and in Laredo at Cruz Roja, Centro de Salud, Seguro Social, all these places are familiar to me, plus my practice here for over 40 years. I know that illnesses and diseases impact both sides of the border. This was true when we went through the global pandemic, which took hundreds of lives in our community. And only through binational collaboration, we were able to live through these challenging times. This is true now, when the Alcaldesa Cantu Rosas and I talk more than ever about public health challenges that impact the border and both our communities. And we're supported by the incredible team in our health departments and incredible advocates. Dr. Arjona and Dr. Chamberlain constantly engage in binational public health meetings and summits where they have taken steps and promoted strategies and addressed challenges with water, air, and health. So I do want to thank the individuals in the room and the Mexican and American consulate, thank you, Consul, because it takes a team to make some of these programs work. And as mayor, I will always continue to promote collaboration between both our communities because binational is more than just a word. It is a way of life. And if you live on the border, you understand it. So I thank you for all the efforts and promoting binational health and look forward to improving the health of our community and our region. And thank you very much, and God bless.
Thank you, Mayor, for the words. Public health is strengthened when state agencies partner with local and international leaders to serve our border communities. It is my pleasure to introduce Ms. Alma Ochoa del Toro, Manager of the Office of Border Public Health, Region 11, to give a few words.
Good morning. It's an honor to join you today for the Border Binational Health Month Proclamation ceremony. My name is Alma Ochoa del Toro. I serve as the Program Manager for the Office of Border Public Health in Region 11 at the Texas Department of State Health Services. This month reminds us of the unique challenges and opportunities along the U.S.-Mexico border. Health knows no borders, and our communities are deeply connected through families, culture, and daily life. That is why collaboration is essential. At DSHS, we are proud to work hand in hand with our partners in local public health, City of Laredo, the Mexican Consulate, Secretaría de Salud, and various community organizations on both sides of the border all along our region. Today is a celebration of that teamwork and a reminder of the healthier future we are building together. Thank you.
At the heart of community health, we have the dedicated professionals who work every day to protect families in the city of Laredo. We are proud to welcome the Director of the City of Laredo Health Department, Dr. Richard Chamberlain, to share his perspective.
Good morning again, everybody. It's a pleasure to be here with everyone, and the weather is turning out to be quite nice. I know we're still a little muggy, but we're appreciating the cool down here in Laredo. And it's an honor to be with you today as we celebrate and kick off Binational Public Health Month and our Public Health Fair. This is a time when we come together not only to raise awareness, but strengthen the ties that unite our communities on both sides of the border. Our partnership with Secretaría de Salud, Tamaulipas, Jurisdicción número 5, el Gobierno de Nuevo Laredo, reflects the importance of constant communication. Together, we share epidemiological data, identify trends, and transform information into clear guidance that helps us prevent infections, promote healthier choices, and protect the well-being of the people we serve. We are all living through a very challenging time in public health, but this moment also highlights the strength of our collaboration. As a unified group, we remain committed to excellence and to making the most of resources available to all of us. Binational Public Health Month reminds us that la salud no tiene fronteras. By working together, we can reduce chronic disease, eliminate infectious diseases like TB and HIV, and address social and environmental factors that help shape health every day. We do this by cuidando nuestros vecinos, by addressing the challenges right at our front door and planning strategically for our future. I want to thank each of you for your presence, your commitment, and your willingness to share in our mission. Together, we can build a happier, healthier, stronger, and more resilient population, one generation at a time. Thank you.
Muchas gracias, Dr. Chamberlain. Representando al Gobierno de México, reafirmando los fuertes lazos de colaboración a través de nuestra frontera, es un honor para nosotros dar la bienvenida al distinguido representante del Consulado de México en la ciudad de Laredo, el Cónsul General, embajador Juan Carlos Mendoza, para dar algunas palabras.
Muy buenos días. Good morning. We're very happy to be here once again. Every year we celebrate the Health Month. We started this endeavor 25 years ago as a week, and now we changed the domination to a month because the health is the most important issue in the human society. Mexico and United States are strategic partners. Mexico is the partner number one in trade of United States. But not only, the most important is not only the trade. In order to conduct the trade, you need the population, you need the people, and you need help people. It doesn't matter what are you doing or what are your mission. If you don't have a healthy population, a healthy people, the rest, it doesn't matter. We had a good experience some years ago with Dr. Trevino, with many different sectors here on the border. We conducted the transnational, the binational program of vaccination, transborder vaccination programs, and it was the most successful program of public health along the border between Mexico and the United States. So there is a lot of collaborations. It's very important the participation of different agencies, the politicians. And nowadays, I think that the most important is to disseminate this idea, to change the culture. It's important, the Latinos, and usually it's a tradition that the Mexican population, the Latino population, try to avoid the visit to doctor. But it's very important. Ironically, the paisanos check every 5,000 miles, they change the oil of the troca. But at the same time, it's very important for them to check the blood of the body, because it's the way you can discover if you are in good health or if you are developing any illness. So it's very important, this tradition. Now, since this is a binational health month, I want to say just my closing remarks in Spanish y agradecer de veras profundamente a nombre del gobierno mexicano todo el apoyo que se tiene para la población. Estamos unidos no solamente por el río, por la cultura, por el comercio, estamos unidos por la necesidad y la misión de avanzar a un mejor futuro, un futuro compartido. Las fronteras son un invento artificial que han hecho la geografía y los gobiernos, que no detiene ni las epidemias ni los virus. Por eso es muy importante el sentido que aquí se ha desarrollado con visiones como la del doctor Treviño, de que esta es una frontera. Yo recuerdo el argumento en la pandemia era, primero, tenemos que vacunar a todos los americanos antes de darle una vacuna a México, y el doctor decía, no, si no vacunamos también a los mexicanos con los que estamos interactuando, la mutación del virus nos va a hacer que no terminemos nunca, ¿no? Y creo que de eso se trata, la colaboración que vemos mes a mes en estas reuniones binacionales y la que día a día tienen los dos departamentos de salud, es muy importante. Todos los días del año trabajamos en cuestiones de salud, pero octubre pues es el mes de la salud. Los 53 consulados de México en Estados Unidos están haciendo todas estas promociones, y invitamos a toda la gente a que se acerque, que se vacune, que no le tengan miedo. Muchas veces dice, ¿qué tal si me sale algo que tengo mal? Pues qué bueno que lo descubrió, porque ese le puede salvar la vida, esa visita le puede salvar la vida, ¿no? Yo soy prueba fehaciente de estas visitas al doctor. Si no, créanme que no estuviera aquí si no hubiera sido por la medicina preventiva. Entonces, ese es el mensaje para toda la gente, acérquese, acérquese. Esto no tiene nada que ver con la situación migratoria, con nada. Esto tiene que ver con una parte muy importante que va en beneficio de toda la población y que va en beneficio de Norteamérica. Muchas gracias a todos quienes hacen posible este mes de la salud, y muchas gracias a todos quienes hacen posible que día a día la salud llegue a toda la gente de América del Norte. Muchas gracias, Mayor.
Muchas gracias, embajador, por sus palabras. To conclude our program, it is my privilege to introduce the leader of our city, who will deliver the official proclamation for Binational Health Month. Please welcome the Honorable Dr. Victor Trevino, Mayor of the City of Laredo.
Right. Office of the Mayor, City of Laredo, Texas, Proclamation. Whereas today we inaugurate U.S.-Mexico Binational Health Month in Laredo, Texas, to celebrate a mobilization of community agencies and volunteers working together to improve the health and well-being of our community, Hispanic, Latino, and migrant population in the United States. Whereas this celebratory event is carried out in partnership with the City of Laredo Public Health Department, the Mexico Secretaría de Salud, and the Texas Department of State Health Services, Office of Border Public Health, and the 10 U.S.-Mexico border states, and many partners that help address the health priorities along the border. Whereas border health priorities such as tuberculosis, HIV, sexually transmitted diseases, chronic diseases, disease surveillance, poor mental health, and drug abuse are among living in the border areas compared with people living in non-border areas, and this variance increases because border residents are more often likely to face social determinants that negatively impact health, such as poverty, transportation barriers, and lack of economic opportunity. Whereas Los Dos Laredos public health professionals help communities prevent, prepare for, withstand, and recover from impact of a full range of health threats, including disease outbreaks such as COVID-19, the pandemic, measles, natural disasters, and disasters caused by human activity. Now, therefore, I, Dr. Victor D. Trevino, by the virtue of the authority vested in me as Mayor of the City of Laredo, County of Webb, State of Texas, do hereby proclaim October as a U.S.-Mexico Binational Health Month 2025 in Laredo, Texas, and call upon all the people of Los Dos Laredos to observe this week by helping our families, friends, neighbors, and co-workers and leaders to better understand the value of binational public health and supporting great opportunities to adopt preventive lifestyle habits.